My name is Patty Marmon. I'm 63 years old and I live in Solana Beach, California. I had a mammogram and an ultrasound in mid-June, and they were both negative. And then when I went to follow up with Dr. Wilde, I usually examine myself first, and I didn't find anything, but I happened to look in the mirror and I saw a dimple. So I brought that up with Dr. Wilde, and the dimple indicated a little lump, which was breast cancer. So even though I had a negative ultrasound and a negative mammogram 2 weeks before, I had breast cancer. Well, Dr. Wilde told me it was stage 1 breast cancer, and she told me my treatment options were either a mastectomy or a lumpectomy with radiation. Once I got the diagnosis and the options, I spoke to a lot of my family and friends who had been through it. I know, unfortunately, a lot of people that have had breast cancer and many who had similar cases to mine. I felt really confident in my doctors, so I didn't go looking for any other doctors, but I spoke to a lot of people and felt that lumpectomy with radiation was the best way for me to go. I was aware that the surgery had been a success and the treatment went well with the Mobetron, so I was very relieved. And now I have my life back, and I hope it's something just in the rearview mirror now. My biggest support was my husband. He was amazing, and of course he was waiting for me when I woke up from surgery and was with me every step of the way. And also the doctors, nurses, technicians, receptionists, everybody at Scripps was fabulous. They just made everything a little bit easier than it probably would have been. If I had a friend that was diagnosed with breast cancer and she had the option to use the Mobetron for the IORT during surgery, I would suggest it because it was very effective to me. I was able to reduce the number of radiation treatments, which in turn prevented me from having a lot of pain at the end. As a cancer survivor, quality of life now means that I can go about my life as I had before my diagnosis, with perhaps a little bit more appreciation of everything that I'm doing.